we have neurotransmitters, we have psychopathology, then we have pharmacology, which is psychopharmacology, right? So now this is the deal. When we have an imbalance in this neurotransmitter, okay, 3, 2, 1, right? For example, serotonin. We have an imbalance supposed to be at level 2 for us to be happy. Okay? Then something happens to the second jar. Level dropped from level 2 to level 1. Now, because of this drop in serotonin, we now have what? We now have a sad face. We flip from outside to inside, like with a bunch of tears too running down our face, right? That is still serotonin. So serotonin went down from level 2 to level 1, hypothetically speaking. So now we have created what? A psychopathology. We can't leave anybody crying forever. So you, as the provider, you're now going to recognize the person and drop some tablets in here and say, yep, I can help this person. I need to do something to help them out. First, I need to figure out what kind of depression that they have. Is it mild? Is it moderate? But you are not happy right now at what you see. So you feel like, you know what, I need to make a U-turn back to farm so I can make them happy again. So you came here, you took them from level 3, from level 1 back to level 2. It doesn't work so fast, but let's hypothetically speaking, that's what we're doing with this SSRI. That is the pill in here. You dropped it in here, you're able to replenish them and get them back up. So that is what we're doing. Now, you got them back up, and that is great that you got them back up. They are laughing from, side to side. Now they are back to what they were when their level was normal. We're now going to focus on this one right here. There are two main treatments in psych. We have psychotherapy, we have psychopharmacology. Psychopharmacology, we are using chemicals. Psychotherapy, we are using words to heal people. Listen, when we use words, we don't misuse words. We don't overdose on words, right? But when we use farm, there is a lot to go into it. A lot goes into it. What about the interactions that we can potentially get from this farm? The food-drug interaction, the drug-drug interaction, the drug-disease interaction, and other emergencies that can potentially occur from giving this drug. And that is what we're going to focus on. So on that board exam, you're going to focus on safety. How do you keep your patient safe? When I give serotonin, what am I looking for? I am looking if the patient has got serotonin syndrome, serotonin discontinuation syndrome. Are they taking St. John's wort that can potentially cause them to have serotonin syndrome? Are they on a medication that can potentially cause QT prolongation? And they have QT prolongation going on right now, or they are on another med that can potentially cause QT prolongation. How do we prevent that SSRI from adding more to the problem? Are they compliant or not? Are we giving drugs with the long half-life or short half-life? Do they have other comorbid condition, and we have to worry right now that this SSRI is going to create or complicate whatever they already have? A lot goes into it because now you're not giving this meds, you are prescribing it. So we got to take off that nursing uniform and get down to it. We are prescribers. We are prescribers. We need to buy our name back. NP's reputation is down in the hole. We need to buy it back because I know we are capable, period. Speaking as Dr. Kehinde Elisha, founder and CEO of NP Certification Academy. Today we're going to be talking about psychopharmacology. And before I go deep into psychopharmacology, I'm going to do a little bit of preamble at the beginning. I will talk about the basics of pharm. Before we even get to this interaction, there are what? 3 main things we must know about pharm to start with. We must know the pharmacokinetics, pharmacogenomics, and pharmacodynamics. Listen, pharmacokinetics is about movement. We're talking about the ADME process. That is the absorption, distribution, metabolism, and excretion. And that is where we get our CYP450 system from. During that metabolic phase, there is a place where the car crashed. What I call a car is the CYP. That is the cytochrome P450 enzyme system. When this crashes, 2 things comes out of it. They are inducers and inhibitors. So anytime we prescribe drug to our patient, two things will likely happen. Is that the drug is being induced or the drug is being inhibited. Okay, substrate does not have any effect on the drug, it's just a regular drug. If anything, the inducer or the inhibitor will affect the drug. Now, we're going to talk a little bit more about that later. Now, what about the pharmacodynamics? Now, we're talking about what exactly is going on. Now that I swallowed the Tylenol, the drug is inside my body. What is going on with the drug inside my body? What is the drug doing inside my body? How is the drug working inside my body? That is the pharmacodynamics. Now, when the drug is also working inside my body, there are processes involved. We also have agonist effect, antagonist effect, inverse agonist, and partial agonist. We must put all this together and connect the dots from there. Now, in addition to all of this, as we are prescribing this meds, you're also worried about lab values. What labs do you need? When you are giving carbamazepine, what lab do you need? Do you know that? If you don't know that, you are not ready for this test. When you're giving antipsychotic, what lab do you need? When you are prescribing SSRI, do you need to monitor anything? What are you monitoring for? Do you know what it is? We're now going to dive right into it. Speaking is Dr. Kehinde, Elisha, founder and CEO of NP Certification Academy. To reach us, nurse-to-nursecoach@gmail.com or visit www.npcertificationacademy.com. Are you ready to dive right into pharmacology? I am ready. Let's get started. Thank you.